Head Cases Stories of Brain Injury and Its Aftermath is a book of 11 survivors of traumatic brain injury and the troubles that follow them and their families. The worst catastrophic injury to the human body is known as the traumatic brain injury, commonly called TBI. As many as 5.3 million Americans are living with a permanent disability resulting from a brain injury, a full 2% of the population. A tap on the head and anything can go wrong. Anything usually does go wrong. You may not remember how to swallow, or you may look at food and perspire instead of salivate, and salivate when you hear your favorite song. A brain injury can shatter your notions of the future, splinter your past, and send your sense of time whirling in any number of directions, and that's just the beginning. Of all the medically challenged injuries, traumatic brain injuries require the most involvement and cost over time. This sequence of events goes something like this. The brain gets damaged, and 2 months later the $1 million insurance policy is depleted, and the patient is shuffled out the door with a shrug of the shoulders. A course of treatment that should have lasted years is cut short before it even starts. It takes on average $4 million over the course of a lifetime to treat a TBI. At a cost averaging $1,000 a day, most people can hardly endure the financial burden of 1 week's worth of rehabilitation, much less a stay that should have lasted months or years. The reason I chose to do my report on this book is because I myself suffer from a traumatic brain injury that I acquired from a car accident in 2002. It was the second day of school my senior year. School had just let out, and I was the passenger in a '97 Ford F-150, and I had regrettably neglected to buckle my safety belt. I was in a coma for 11 days, and just like Julie in Prisoner of the Present from the book, the surgeon burrowed a hole just past my hairline and on my forehead and set an intracranial pressure ICP monitor to alert the nurses if swelling had become uncontrollable. Before transferring me into ICU, they also placed a peg tube so that I could be fed directly through my abdomen and required a ventilator's help for breathing. The book Head Cases discusses how traumatic brain injuries negatively affect not just the survivors but also their friends and families. In the book, a survivor's mother is quoted as saying, "I have noticeably aged in the past few years. The bills are taking a toll on me emotionally, and I am stretched to the limit. I know that his injury has brought us closer together, but trust me, there are better ways to deepen your bond with your children." Most all TBI survivors suffer from seizures. Things that trigger these seizures could be anything from a monitor from a home computer that flickers at a rate that irritates a sensitive area of the brain or a certain beat on any given CD. The kind of seizure that I suffer from is the most renowned and feared seizure, the grand mal or the clonic-tonic seizure. During a grand mal, an individual is unconscious while the body racks itself in a joint torquing frenzy. The only thing worse than a grand mal is a grand mal that won't quit. Textbooks regularly state that seizures over 5 minutes in duration require immediate medical attention. It is a life-threatening condition that locks onto the brain and denies it any escape. Like so many other people with brain injuries, rage is a part of the injury. The story Portrait of an Injury in the book describes how prior to the injury, Asia was considered a sweet-natured child, but after the incident she flew into devilish rages without the slightest provocation. People with frontal lobe injuries regularly report that they're unable to stop making statements that they'd rather keep quiet. I can tell you personally that living with a frontal lobe injury is like living with a foot in your mouth. At work, I might just as easily tell one of my diners to have a nice day or to shove his menu up his ass. Many of the injured carry a sense of negation with them. They feel lessened, victimized, demeaned, and insulted by their injury. Each day serves up a reminder of the skills they have lost. Head Cases discusses the survivor story of Melissa, once a very capable worker, now her executive functioning is impaired. She struggles with duties involving multitasking, decision-making, and organizing. There were awkward moments when she cried at the slightest provocation or snapped at her assistant. She had once excelled at complicated managerial tasks. Now the most menial chores, such as writing a complete sentence, proved a challenge. I would recommend this book to anyone, and especially those who know someone with a traumatic brain injury. After reading this book, you will know tremendous amounts about the inner workings of someone with a traumatic brain injury.